Welcome, my name is Peter Strong and I provide Skype therapy for the treatment of anxiety and depression and addictions, and for help with OCD, and also for work with PTSD as well. So Skype therapy is a very good choice if you're looking for an alternative to a medical-based treatment for your anxiety or depression. So Skype therapy simply refers to psychotherapy that's offered over Skype. It's just as effective as in-person therapy because the Skype format allows you to see each other. And this is really essential. You must see each other. But if you can see each other, then there's really no difference in the effectiveness of Skype therapy compared to therapy in person. You don't need to be in the same room as a therapist, but you do need to see each other. That is what is required to allow effective communication, which is obviously essential for good psychotherapy. People often ask me if Skype is secure, and it is. It's a very secure, very reliable service. Skype calls are encrypted, and it's probably more secure than a telephone line. The other question I'm often asked is Skype therapy HIPAA compliant? And this is a new area that's still under development, but generally HIPAA, HIPPA, refers to health insurance claims. So basically it's a way of regulating the what health insurance companies do with your medical records. But Skype therapy is not a medical treatment. It does not involve diagnoses. It does not involve physical treatment as part of the recovery process. So most people who are seeking therapy via Skype are not looking for a medical treatment. They're simply looking for a better way of working with psychological suffering, with anxiety and depression, OCD, or traumatic memories, and so on. So, although Skype may not be HIPAA compliant, it does not mean that it's not effective. It is in fact often a lot more effective than meeting in person, for the simple reason that it's more comfortable for you as the client, and that's really important. Sometimes clinical settings make it very difficult to get the quality of psychotherapy that you need. Psychotherapy also recognizes that anxiety and depression are caused by psychological factors rather than medical or clinical factors. Psychological factors are fundamentally subjective in nature. So it's not anxiety or depression is not due to a simple physical cause, but it is due to the subjective response to that cause, that trigger. And people respond very differently to the same triggers, the same factors. So that subjectivity is psychological in nature. So psychotherapy helps you work with your subjective conditioned reactions to events. So the style of Skype therapy that I teach is called mindfulness therapy, which is one of the best approaches available after CBT for working with thoughts and emotions, helping you change those underlying subjective habitual reactions that are the real cause of your anxiety or depression. The way we go about doing this during our sessions together is to learn how to meditate mindfully on your emotions. So meditation here means looking very carefully and closely at the mind to see these patterns of habitual reactivity. Meditation is not an escape from the mind, but rather a way of changing your relationship to your mind, to your thoughts and emotions and memories, and so on. You have to work at that level of changing that relationship, because that's where the real cause of our emotional suffering is to be found. People become anxious or depressed because they become blindly identified with those habitual reactions. They become blindly attached to habitual beliefs about themselves, about their life and their situation. It's this quality of relationship that's based on subconscious reactive identification. That's the real problem. So in mindfulness therapy, we seek to overcome this blindness, this unconscious quality of these habits that cause anxiety and depression. And the way to do that is to meditate on those habits. That means bringing conscious awareness to see them in operation very clearly. And the more you become aware, the freer you become from the influence of those conditioned reactions. So we meditate on our emotions. We learn to see the reactive thinking that accompanies those emotions. And we start to break free from that blind identification with all that rumination and reactive anxiety-producing thoughts. We start to see them more like objects being projected on a screen. It's like watching a movie instead of becoming a part of that movie. We learn to become the observer that sees the movie but does not become the anxiety or depression. That training in what we call objective consciousness is an essential feature of mindfulness therapy. And it's very, very powerful because it basically takes you out of that habitual reactivity that keeps you a prisoner. It allows you to see things differently. It allows you to change your perspective. And it allows you to break free from those habits. And this is the necessary condition for healing. You have to develop that inner separation from your thoughts and emotions in order to help them heal and in order to allow them to heal. Because a great deal of the process that sustains anxiety and depression and other emotions, including PTSD and the reaction to emotional trauma, the real issue is the way that we react to these experiences, that we react to the memory or to the anxiety or the depression that we are experiencing, and create more reactivity that propagates it, that basically feeds the anxiety or depression or trauma. So that reactivity feeds the emotional suffering. So that internal process of feeding the emotional reactivity is a real problem. And it usually operates subconsciously without our being aware of what's happening. So in mindfulness therapy, we learn to change everything around to develop full conscious awareness of exactly what is happening when there is anxiety or depression, or when there is the experience of emotional trauma. So the more you see, the freer you become. The more you're able to develop objective, mindful consciousness, the more that facilitates healing. And healing is the primary objective of mindfulness therapy. We don't see anxiety and depression as a disorder that needs to be treated. We see them as conditions that are trying to heal in very much the same way that you would look at a wound. You don't usually need medical treatment if you cut your hand. What you do need to do is to change your relationship to that wound, to one that is conscious and also one that is compassionate, that is, that takes care of that wound. If you do that, the wound will heal itself. Our emotions are very much the same. They are like internal wounds that are not healing, and they're not healing because of our reactivity. So when we start to change our relationship to our internal emotional wounds, to one that's based on non-reactivity, on conscious awareness and compassion, that is mindfulness, then healing really it takes place at a much accelerated rate. So during our Skype therapy sessions, I will teach you how to apply mindfulness and how to meditate on your anxiety or depression to achieve this healing. The approach is very effective indeed, and it's much more effective than just talking about your feelings or taking medications. Medications are not going to change anything internally at the psychological level. Those habits will remain intact. In fact, medications are really nothing more than a form of avoidance. They do not promote healing. They simply dampen symptoms. But the moment you stop medication, or that the medication loses its potency, then the anxiety and depression comes right back. Why? Because those internal psychological habits have not changed. So if you really want to change things, you must focus on changing those internal reactive habits. And that is the primary direction in mindfulness therapy. If you'd like to schedule some Skype therapy sessions with me to try out this approach, then please contact me and tell me more about yourself and what you've tried. Tell me what times work for you, and then we can schedule Skype therapy sessions, and you can start to experience just how effective mindfulness therapy can be. Most people see really quite substantial changes after the first few sessions. The key is learning how to apply these methods that I'll be teaching you during the Skype therapy sessions. It's what you do at home between sessions. Much more effective than trying to seek a treatment in which you're just the passive recipient. It's what you do yourself that will make the difference. So please contact me if this interests you and we can schedule some Skype therapy. Thank you.